This is a case of failed finger amputation, replantation. See, the dry gangrene sets in with caver in situ. Plan for thorough debridement and exposure of the distal phalanx that has been implanted. See the volar, dorsal and the lateral view. All aspect the distal phalanx in situ after caver fixation. Now plan for abdominal flap, inferiorly based, random pattern and infraumbilical right side. So see the flap that has been planned for and see the inset all around 360-degree. Immediate after OT, after 1 day, 24 hours later, see the edema, the changes in the color, gradually settling of the edema is going on. After 3 days post-op, see the color change and the overlying skin changes with caver in situ due to the continuous traction. The caver exposure is there. The bone we can see to some extent, it can be visible on the radial aspect of the thumb. It is after 2 weeks. Now after 3 weeks, detachment of the flap done. On the radial aspect, on the ulnar aspect and dorsal aspect, you can see the flap. The re-inserting of the suture after flap detachment, you can see the small portion of the bone is exposed and the flap has to be settled down. See the well settled flap, but the radial aspect of the distal phalanx bone slightly exposed. So we are going to see the exposed bone that has been gradually covered with the granulation tissue and small part has been exposed. So we are now going to plan to cover. Caver has been removed. You can see maximum part has been covered, but the gradual involutions of the wound. So sometimes not to do anything is the best way to do something. You can see the almost cover up, but as of now the little part has been exposed of the distal phalanx. So gradual involutions of the thumb implanted part. So we are planning to do a small rotation flap. So here the small rotation flap has been done after 3 months of the initial surgery. See almost the coverage of the area that is exposed. No osteomatic changes till now. So after 24 hours you can see the wound. It is immediate post-op. It is after 24 hours. And after 1 week you can see it is almost healed. Thus the suture is going to be removed after 1 week. You can see that everything has been properly healed. Now the suture has been removed and no bony exposure is there, and patient is quite happy with the final scarring and coverage of the thumb tip, and the length has been properly maintained for the thumb.